people who fail to regulate their sleep, they often think that the first catch-all solution might be to go on some type of medication.
Yes.
Ideally, that would be sort of the last line of attack there for that problem. So, how do we delineate between who that's actually useful for, and maybe what should everybody else sort of be considering before they get there?
Yeah, it's complicated, but it's very important to appreciate that sedatives, sleeping tablets, are sedatives. They do not provide a biological mimic for sleep. In fact, some of the sedatives can actually harm memory consolidation and the processing of information. Many people, of course, use alcohol as a sedative. And so that will sort of knock you out, but it actually doesn't provide good sleep. Sustained sleep, and again can severely inhibit memory and processing of information. Short-term use of prescribed medication to try and consolidate the sleep-wake cycle is fine.
Okay.
The long-term use is what I think everybody would suggest is a poor idea. There's also, it's not a smart idea for aged individuals, and particularly individuals who are showing signs of dementia and Alzheimer's. And of course, the sleep-wake cycles fall apart quite significantly in that group, because it might knock you out, but then it results in lots of daytime sleepiness. And also, if you wake up in the night, it can lead to falls and therefore, other issues. So, medications for sleep are not recommended in the elderly, and particularly the elderly with dementia and Alzheimer's. What you do? Well, again, we go back to my favorite topic of light. And it's been shown, some researchers in the Netherlands, As van Summeren's group, increased the amount of light in the nursing home, 2,000 lux during the day, darkness in the bedrooms at night, and it consolidated the sleep-wake profile in many individuals. And those with a consolidated sleep-wake profile showed an improvement in their cognition by almost 10%. So it's a very important set of interactions,
right,
that we don't always have to resort to medications. It raises the other point, of course, which is, why don't we teach our general practitioners and our medics more about the importance of sleep and circadian rhythms?
What education do clinicians get, let's say in medical school or in nursing school? What type of education are they getting?
Very little indeed. And so, for example, when do you take your antihypertensives? These drugs which lower blood pressure, reduce the chances of a stroke. Well, the data now are very clear. Taking them before you go to bed rather than first thing in the morning can halve your risk of a stroke over a 10 to 15-year period. So this is a big effect.
Right.
But most general practitioners are not aware of that. In fact, if they're aware of anything, is that stroke is most frequent first thing in the morning. You wake up, blood pressure rises, and you precipitate a stroke. But it takes a relatively long time for these drugs to kick in. So your window of stroke danger between 6 a.m. and 12 noon.
Right.
The drugs are actually kicking in after that window. So
I see.
That's why you take them before you go to bed, so they remain high to intersect with that sharp rise first thing in the morning. Now that isn't known by most practitioners. It's becoming more clear. And in fact, an Australian colleague of mine said, yes, in Tasmania at least, that's when we always tell our stroke, potential stroke patients, take your medication in the evening before you go to bed. But I was at a meeting just at the weekend, and somebody said, but I've been told I must take it in the morning. What's the evidence? And so, I sent them a copy of the paper.
Oh, did you?
Yeah.
Good.
And again, that's one of the exciting things about Lifetime, because science is constantly changing, and the statements we make now may be wrong or need refining in 5 years' time. But at least within the book, you can go to the source information. And I had this wonderful call just recently from a lady who said, "Oh, I was really fascinated to hear, you take your anti-stroke medication before you go to bed rather than first thing in the morning." And I told my husband, and he said, "Oh, don't be ridiculous. It won't matter any time." And she said, "Well, why don't you go to the paper?" And of course, he got the paper, the reference from the book, read the paper, and said, "Oh my goodness, yes." And so he's changed his behavior. So, it's providing the current...
Fantastic.
Yeah, it is. I mean, I was really thrilled to get that because it's providing the current evidence base for people to make their own decisions about what they do about their health.